Hi, everyone, and welcome to today's OR Manager webinar, Optimizing the OR, Strategic Insights for Perioperative Business Leaders. I'm Carrie Shapiro with OR Manager, and I'm thrilled to introduce our guest speaker, Zach Tudor, Perioperative Business Operations Manager at Northwestern Medicine. Zach also serves as the Program Chair for the 2026 OR Business Management Summit, taking place February 9th through the 11th in Austin, Texas. Today, Zach will share his expertise on the evolving landscape of perioperative business management and provide actionable strategies to help you optimize efficiency, strengthen financial performance, and improve OR operations. Throughout today's webinar, we encourage you to submit your questions using the Q&A tab section in the upper right corner of your screen. Please note that your question will only be viewable by the presenter. It is now my pleasure to turn things over to Zach to get started with today's presentation.
Thank you, Carrie. And hello, everyone. Thank you for taking time out of your days to join us for this webinar. I'm excited to be here and share some of my thoughts and opinions and experiences, and really looking forward to what will be a much better and thorough description of what OR Business Management is, which is the summit that's planned for February 9th through the 11th in Austin, Texas. And that will not be the only time you hear me plug that summit event. So, Carrie, thanks again for inviting me. And just to give you all a little bit of background of who I am, like Carrie mentioned, I work as the business operations manager for Northwestern Medicine in Chicago, Illinois. And prior to joining this organization, I worked in the same role for Honor Health, which is was at the time a 6-hospital system in Phoenix, Arizona. I know they've grown since I left. So I've been in the business operations world for Periop for 4 years now. Definitely worked in different capacities. At Honor Health, I was really tasked with the OR scheduling, sterile processing related stuff, a lot of capital management, things like that. At Northwestern, my role has transitioned a little bit. I work specifically with the pre-admissions testing team. And then obviously a lot of the business manager responsibilities as well. So it's been a great kind of spectrum of experiences for me so far. And I've had a lot of exposure to the intra-op and post-op areas as well. So anyway, I'm going to share some of that today, and I'll go ahead and go to the next screen here. I do want to just give a quick disclaimer. The thoughts and experiences I share in this presentation are mine. They don't really reflect my employer or really any other entity. And I really kind of struggled with what to include in this presentation, in this webinar, because there's so much to talk about. There's so many different areas of the industry that we could focus on. So I kind of use my own discretion to hopefully make something that you all will enjoy and get some solid takeaways from. So just to give you a sense of what we're going to go through today, I plan on addressing many of the recent developments or trends that I notice within the industry. I also would like to leave you all with a couple of takeaways or maybe actionable insights that you can take forward in your roles. And then, like I said, I'm definitely going to encourage you to join me for the OR Business Management Summit that's in Austin, Texas, because I don't consider myself an expert in many of these areas, but I do know that there will be great opportunities for you to hear from experts, hear from peers, hear from vendors at the summit regarding all the topics that I'll talk about today and beyond. So let's dive on in, and I use that word as a pun on purpose, but I tried to think of an analogy here because the reality of perioperative services is that there are a lot of different lanes of perioperative services. There are surgical centers, there are independent rural hospitals, there are small to medium-sized networks, there's large health networks, there's children's hospitals, there's academic medical centers. There's probably stuff on, that I'm not mentioning, or maybe even combinations of these lanes. But for me, a good analogy was we're all swimming in the same pool, but we have our own lanes. And, sometimes we might switch over to a different lane if we have an ASC at our disposal, or if we have a larger hospital that we're involved with. But I felt like this was an appropriate analogy, and I will do my best to be generic when I uh, reference a lot of the topics I'm discussing, because it's really hard to tailor content to all these different areas when there's, the OR business management role is probably very different across these different swim lanes. And uh, so, anyway, I'll do my best. I tried to make content that was relatable to everyone. But of course, I know that there's variability in responsibilities and within the perioperative settings. So I do want to just, for those, I would hope that there are many people on this call that can relate easily to this slide. But for those that may not be quite as familiar with what OR business management is, I did my best to put my job on a slide. And once again, not an easy task when it really comes down to it, but I tried to capture across the bottom a number of different fundamental responsibilities that I have as an OR business manager, and I think many of my peers have as well. I'm not going to go through all of these different topics, but I will touch on a couple of them. Data analytics to me is a big part of this role. Being able to tell a story through data is critical, and it's really helps generate conversation, take action. Definitely one of my favorite parts of the job. I think there's plenty of interest and trending activity around case scheduling, and I'll touch on that here in the next slide. But that's definitely something that consumes a lot of my day to day in my previous role and in this one. Another part that I really enjoy is the strategy and growth aspect of this job. Really focusing on who should we grow, how should we grow, and navigating recruitment or retention, and thinking about all the different pieces of the puzzle that go along with either bringing a new service to your area or extending a current service. So, all of those areas to me are definitely some of my favorite parts of my job. Um, and then across the bottom, you'll see that the word management over and over again. I think that is a very important term naturally in an OR business manager role, but the amount of staffing management, inventory management, project management, change management, all of those things go hand in hand, and you have to use all these different management skills to do them. So, like I said, not going to spend a ton of time going through these, but I will highlight some of this in the subsequent slides. And I will apologize, it's a little bit unique of a setting where I don't get to engage the audience and ask questions along the way. But as Carrie mentioned, feel free to pop things into the chat real time, and we'll either address them at the moment or at the end. And like I said, I'm going to be jumping kind of from slide to slide or topic to topic, maybe a little bit sporadically. So I apologize for what might appear to be a little chaotic. So I really don't think we could have this webinar without addressing the technology ecosystem that exists in perioperative services. So, this slide is not all encompassing of technology that exists in this field, but I did my best to put on the slide some technologies I'm familiar with or things that I'm reading about, etc. I tried to organize them in the different phases of care, and then there were certain technologies that just didn't fit, I felt like. So anyway, I'm going to highlight a couple of these. I won't talk through all of them, but I can assure you that once again, the summit that we're hosting in February, there will be vendors at present that can talk through these technologies. They'll do a much better job explaining what they are and how they work and how they can add value to your organization. I also think there will be, use case presentations from your peers that you'll be able to tune into at the summit. So with that being said, I mentioned in the previous slide, the trendy AI scheduling tools. I do interact with those tools in my current role. I 100% see the value of them, especially when it comes to being transparent with independent surgical practices that might not have visibility to your block schedule or your availability. Also, and we'll touch on this later, but the whole release aspect of it. If they have block, they don't plan to use it, they release it. These tools facilitate that. Another one I want to highlight is the predictive analytics for risk assessment. So, as I mentioned, I'm the manager of the pre-anesthesia nursing team, and we spend an enormous amount of time essentially assessing patients, identifying potential risks with their care, coordinating tests, so on and so forth. And so I think there are emerging tools and software systems and platforms that really take in patient information, categorize the patients, determine pathways for those patients to take leading up to surgery that ultimately reduce late cancellations, improve patient experience, etc. I'll talk more about this topic in a future slide, but definitely something that I'm tracking as the future in our industry. Another thing I think we're all very in tune with is the staffing shortages that are plaguing healthcare in general. But our surgical suites are not unique to this, and so I've seen and been involved with many different staffing related softwares and AI tools that help you allocate staff, effectively and really use what a short, limited resources we have to its fullest extent. So looking down at the intra-op phase here, if you are a business manager and you have not been involved in conversations about robotic assisted surgery, please introduce yourself after this meeting, because you would be the first person that I met in our field that has not dealt with something like that. So I think that's a no-brainer. The technology that exists on robotic assisted surgeries is very prevalent and trending at this time. Another topic I think that's really interesting is and can provide a lot of value is the inventory management side of things. And so, I actually, in a previous career prior to joining the healthcare industry, I worked very closely with inventory management partners and helped roll out software that was very, very good at managing how much inventory do we have, how long has it been there, how often are we using it, where is it located, and those techniques can save you a ton of time and money. And so I know there's plenty of solutions out there, and I know for me, we use a certain system, and it's proved to be very valuable for us. I think another really interesting technology that I've been informed of is this concept of ambient video and audio. So essentially, it's a camera with audio in the operating room that is collecting information about what's happening in the operating room, who's in there, what are they talking through, what challenges may they be facing, etc. And it's really training this AI model or these machine learning models about what's the day-to-day look like in an operating room, and it can be more predictive using that data. So I do think that there is something at the summit that will discuss this topic. And I know that this is something that will become more and more uh, prevalent in our industry. Looking down at the post-op phase, I think all of these topics deserve, all of these technologies deserve their own session, so to speak. But the one I will highlight is the instrument tracking technologies. I think it's obvious that a lot of ORs and surgical suites have a ton of money caught up in the instrument inventory and repairs and buying new instruments to accommodate growth. Um, so, to me, there are technologies out there that will help you assess. Okay, we picked this many instruments. How many did we actually use? And can we use that analysis to alter how our trays are built, or make changes to our preference card that allow for time savings, or maybe avoid uh, reprocessing instrumentation unnecessarily and taking the labor time to assemble trays and wrap, etc. So, and then on top of that, the obvious statement there is knowing where trays are and how many you have that are clean or dirty. To me, that's very valuable information that these softwares provide. And then the last one that I'm going to touch on is in the other phase, and that is this VR, AR simulation training section. So, from a virtual reality standpoint, I think that there is a lot of technology emerging about, essentially simulating a case and allowing either nurses or surgeons, or even techs, the ability to simulate and learn through these simulations. So I think, from a training perspective, that's very valuable. From a case preparation, if there's a very complex surgery that's going to be performed, you'd be surprised with how um, realistic these simulations can get for the sake of training a team. And then the augmented reality side of this, I think that there's a lot of technology that's coming out about how you can layer on different types of images to make, the surgical site more visible to the surgeons. And there's a lot of interaction between real-time feedback from these augmented reality solutions and the surgical team that's in the room. So, like I said, a ton of really fascinating technology, stuff that will save you time, money, uh, and really help you enhance your operation. So I encourage you to check some of these out, do some of your own research. Happy to answer questions or extend the conversation after this presentation. All right, so I am going to get into some more of the meat of the presentation, which is really trying to take the fundamentals that I described, combining it with the technology that I've gone through, and then just layering into that some of the things that might be trending for me or top of mind for me. And so I'll spend a little time going through some typical operational efficiency metrics that I track as an OR business manager. I'll also touch on a couple of financial metrics that I find particularly valuable. And then these last three bullet points, to me, they're top of mind. They're becoming more and more relevant. They consume a lot of money and time. They're, specifically addressing cost savings and revenue generation, capacity issues. So like I said, I use my discretion to pick a couple of topics that I feel will be valuable for you all to hear about. But as I've mentioned, there's a million more things we could discuss, and we will address many of those at the summit in February. So going into the common operational efficiency metrics, many of you can probably relate to the items on this screen. I'm going to talk specifically about late cancellations and staff room utilization, but I do feel strongly that, especially for staff room utilization, there are many of the metrics on this screen are related and interdependent, and feed into one another. So I'm going to jump into late cancellations. And what I'd like to do is essentially share with you some of my experience with late cancellations, maybe give you a playbook or some things to think about. Use at your own risk, because late cancellations can be a very difficult metric to address. So I think one of the key steps for me is creating buy-in from key stakeholders, trying to tell the story. Why is addressing this metric important? And really making sure that all the stakeholders are involved are working towards the same goal and understand why they're working towards that goal. I think another key step is designing the data collection process to have integrity. So we want to make sure that the reasons for cases being canceled are accurate. We want to make sure that the right people are entering those cancellation reasons, etc. And then I'll talk about this in a couple of slides, but I think it's very critical that you be selective in where you apply your efforts. And then, as I mentioned in one of the previous slides, is I think there's a lot of technology out there that can help with the late cancellation process. So, I think that's obvious for many of us why reducing late cancellations is critical. Obviously, patient experience will be negatively impacted. You'll be underutilizing staff and equipment if you have late cancellations. And then, of course, the financial impact. If you don't do a case, you don't get revenue from it. And if you're canceling that case last minute, there's no opportunity to backfill that time and generate revenue from an alternative case. So there's plenty of reason for why you should focus on this metric. So here on the right side is a little bit of a cheat sheet that I've developed, and I hope it's easy enough to read. And if it's not, maybe when you get this deck on the back end of things, you'll be able to read this more carefully. But I've spent a lot of time essentially categorizing reasons for why a case would be canceled, and within those categories, defining the reason, or what about that category should be selected. And so you can take a look there on the right for what might be encompassing of a facility, equipment, or instrument issue. But to me, this is a very critical first step, because you want to have accurate data that you are working with when it comes to evaluating historical information. And then from a data collection standpoint, I think it's important to remove any potential human error or interpretation. So making sure that the right team members are documenting cancellation reasons. The last thing you want to do is be playing a game of telephone where surgeon tells nurse, nurse tells pre-op, pre-op tells scheduler, and now you have a non-clinical team member, the scheduler, trying to interpret this game of telephone and enter the right cancellation reason. So I think that's an important part and a lesson that I've learned along the way. And then, of course, documenting in your EMR, maybe exporting some reports to Excel so that you can evaluate trends is, also very critical for the data standpoint. Another key step here that I mentioned is trying to determine where to intervene, where to spend your time and effort. And the reality that, I think we all understand is there will always be late cancellations. And so on the right side of the screen, for me here in Chicago, weather can play a factor in late cancellations. Or, it's sick season and people get sick outside of our setting of care, and there's not always something we can control with regards to that. But there are many issues that are in our control to prevent. And so, a couple of those to me is the facility equipment and instrumentation issue. I think if a piece of equipment has not been properly maintained, or if an instrument tray is damp or doesn't have an indicator in it, and we have to delay or cancel a case, those are very avoidable instances that you can focus time and effort on intervening with. The same thing goes for financial clearance. To me, if you're waiting till the last day to clear a patient for insurance coverage, I don't think that your process is designed for success. And then another big one I think everyone can relate to is that patient that ate a cookie at 8 in the morning when we claim we told them their MPO instructions. The patient says, "Oh, I didn't hear that." I will take the patient's side every time, because many of these phone calls and pre-operative appointments, there's a lot of information to be told to the patients and comprehended by the patient. And so it's on us to provide clear and concise directions. So anyway, there's always going to be late cancellations. You can't always control that. There are a lot of different technologies out there that can help with this. There's asynchronous video technology, which can help with, closed captioning for multiple languages. You can watch it many times. There's digital questionnaires out there that people can fill out to help with assessing current medical history, medications, etc. That makes the calls shorter. That makes the automatic AI-driven stratification easier, things like that. So I am going to keep jumping through. I want to be cognizant of the time we have. So improve staff utilization. I think this is another very key statistic for me. You can see some of the key steps here on the screen. I am going to go ahead and jump to the next slide because I think it does a better job of explaining the concept of staff room utilization. So the point of what I'm showing here is there are a number of metrics that if you're doing them right, your staff room utilization will be good. And so if you're accurately scheduling cases and you're making sure that your room turnover times are short and tight knit, I think both of those things, along with avoiding late cancellations, et cetera, will all help you have a better staff room utilization. And then, on the other end of that, if you have good staff room utilization, you're going to see benefits to your productivity. You're going to see improved access. The staff will be more satisfied because they're not being low censused or not being overworked. One thing I do want to mention here is I know one thing for us that we deal with is flip rooms. We have orthopedic surgeons that have 2 rooms dedicated to them. And, there are some natural inefficiencies that come with that. And those, that's a barrier to us increasing staff room utilization. And it's a known barrier, but something to be mindful of nonetheless. I'm going to keep jumping along here. I know this is going to get a little chaotic just because of how this presentation's set up. But the one topic, the financial metric that I'm going to talk through today is this contribution margin by minute. I think, once again, there's plenty to be said about these other metrics that I use in my day-to-day. But for time's sake, I'm going to talk through the contribution margin statistic. So the way I define contribution margin is net revenue minus direct costs. So that's like labor and staff. That is the contribution margin. That's the profit of the case. And a lot of times I've heard contribution margin be used kind of globally at the case level. And for me, I think it's more important to break it down to the minute level because that gives you a better picture of the profit that you're generating, regardless of case type or case duration, things like that. So I tried to put up a random example. I made up numbers just so that they were easy and round. But let's just say that people are, there's administrators talking about, oh, nasal wall reconstructions are very profitable cases because they see this $8,000 number. But what they might not be doing is they might not be digging that layer deeper to say, well, how much time did that case consume in order to generate that amount of money? And they might kind of on the other end of things, they might look at a bladder tumor resection and say, oh, like this case doesn't generate as much money for us as some other cases. But when you look at the time that it takes to do that case, it tells a very different story. And so that's where, for me, I think this contribution margin at the minute level can show you that the time it takes to generate that profit for bladder tumor resections is much less time. And I think this can ultimately inform some strategic growth, how to allocate time in your surgical suite. And if applicable, I think this is an important point, but if applicable, it's important to consider excluding the patient class of inpatient. A lot of times charges that happen outside of the surgical suite can be included. So I do want to just throw that out there. It may or may not apply to you. So I'm going to go ahead and get into a different topic, which is capital asset planning. And for me, this is top of mind. It's that season at Northwestern for us to be doing this. So I'm just going to talk through a couple quick things about this topic. Why is it important? If things are working properly, it will directly contribute to patient safety. There's a lot of potential streamline opportunities with less delays and greater throughput, knowing where equipment is, how much you have, is it out for maintenance, etc. And then if you're doing capital asset management right, you can increase the lifespan of your equipment. You can lower maintenance costs. You can decrease rental expenses, etc. And then, of course, it can potentially provide a competitive advantage if this is a piece of equipment that doesn't exist at competitors in the area. So I think we've all been here before where you have $5 million worth of stuff that you want, but you're only given $1 million to spend. And so you have to just whittle down your list of true needs or true wants into needs. And so I tried to throw down some questions that you should be asking yourself. Is the equipment end of life or end of service? How often have repairs happened? Does it improve patient safety? How often will it be used? How many surgeons will be using it? And so on and so forth. So I think you should be documenting your justification for why you need this equipment. And you should be, in that justification, you should be answering these questions. And I think through this exercise of prioritizing and answering these questions, you will make your life easier, going from that $5 million list to closer to that $1 million amount to spend. I won't spend much time on this, but I think something that I'm increasingly focusing on is the renting versus owning concept. There's pros and cons to both. Two of the main things that I focus on when trying to drive towards a decision is how long are we going to need this equipment? If it's short term, then maybe we can rent it. But if it's a long term strategic growth opportunity, I think owning is the better option, right? And then I do think it's important for you to find that tipping point wherever it is in the equation to say, once we've hit this many cases, we will have exceeded the purchase price through our rental costs. And so this is a huge cost savings opportunity. I know how easy it is for equipment to kind of just walk into the building under a rental agreement and just add up over time. So if you're not focusing on the rent versus buy decision, I think it's a very important one that can end up saving a lot of money. From a capital asset management standpoint, there's plenty of software that exists out there. Many of you are probably using it today. I think there's a lot of cool technology around RFID tracking, Bluetooth tracking, even barcodes for where is equipment, how much of the equipment do you have, how old is it, when was it last repaired, et cetera, et cetera, et cetera. So these softwares can be very beneficial in the management of your very expensive capital assets. So jumping to a different topic, revenue cycle management. I think this is a buzzword. It's going to be all over the agenda for the summit. I know depending on what swim lane you're in, you may own more of these bullet points on the right. But for me, in my role, in my experience, these first three areas are the areas that my teams have more control over. And so I'm just going to give a quick highlight to those. So number one, I think this is 100% a snowball scenario where if you don't do things right early on, the problems that you'll face will cascade into a bigger and bigger snowball as it rolls down the hill. So three important things I think you can do to positively impact your revenue cycle management is verify insurance is going to cover the procedure, get prior authorization. I know that's easier said than done, but that's a very critical first step, and you should be doing that at the time the case is scheduled, not 3 days before the procedure. And then, of course, improving clinical documentation, making sure the right procedure is chosen, the right supplies are being captured, and the surgeons are putting in all the right verbiage into their intra-op, post-op notes. And then, of course, making sure that the charges you're capturing are accurate and they're being captured in a timely manner, resolved in a timely manner. So the last topic that I'm going to talk through, I know I just went from capital asset management to revenue cycle management, and now I'm going to be going to the strategic utilization of a surgical services network. I know that's jumping around, but I do want to touch on this topic because I think it's going to become increasingly important for health systems and even independent ASCs or hospitals to be aware of the opportunity here. So for me, this is a big responsibility. You have to be, if you have a hospital, or maybe like in my scenario, we have an academic medical center, we have community hospitals, and we have ambulatory surgery centers. Deciding where to do certain cases based on the acuity of the patient, the acuity of the procedure, et cetera, is very critical to our success and the appropriate utilization of our resources. So assessing the capabilities and limitations of each facility is important. Making sure you have the same staffing models and supplies across the sites of service is important. The third bullet point's the hardest, and I'll touch on that in the next slide. And then, of course, evaluating the impact of your efforts. It's important to justify or be able to quantify what you're doing and how it's helping. So this is my attempt at a very basic graphic, but essentially you want to try to decant cases to the appropriate site of care. And some factors that you should consider while doing this are, what's the complexity or the duration of the procedure? What's the patient's health status? That changes in almost every scenario. How long will recovery be? How involved will recovery be? What's the anesthesia type? Do you have support services at your facility? Does your ASC have a blood bank or have surgeon, general surgeon backup if something doesn't go well? Of course, the second to last bullet point might be the most important from a financial standpoint, which is, do the payers reimburse at a healthy rate or at a better rate at certain places more than others? And then I think, patient convenience is another critical factor to consider. So it's easy to put this stuff on paper, super hard to do. And I think many systems and many surgical suites around the country are focusing on this topic. And so, with that, I think it's obvious there's so much more to discuss. I ran through those topics very fast. Um, once This will be the last plug I make, but I think that the OR Business Management Summit will do a much better job of explaining these topics and many more, giving you the venue to talk with peers and vendors about all of this stuff. So, encourage you to join. And with that, I will open it up for any questions or comments or feedback.
All right. Thank you so much, Zach. That was incredibly helpful, very educational, and a great preview of what's to come for the OR Business Management Summit. And before we move into the Q&A session, I'd like to let everyone know that we're offering a special 10% discount for the OR Business Management Summit. As a thank you for attending this webinar, you can save 10% with promo code PREVIEW, and that's in all caps. And you can register online at orbusinessmanagementsummit.com. And you should see a box pop up right now with the promo code, and there's a link to visit the website. And then you can just close that X, and we'll dive into the Q&A. So Zach, in your experience, what is the most effective way for a business manager to influence capital planning decisions when they're not the ultimate budget holder, but they're still being held accountable for performance?
Yeah, that's a good question, Carrie. And, it will go back to that slide that I presented, which is, it's very important for you to have a thorough justification of your ask, and you have to tell a good story, tell a compelling story, because in many instances, you're not just competing with the surgical services needs, you're competing with, some plumbing issue that the facilities team is asking to upgrade or whatever it might be. So, you have to tell a compelling story. You have to be able to demonstrate a return on the investment, because, the dollars is what catches the decision maker's eyes. You have to show how it aligns with strategic growth. But I guess more than anything, it's probably you have to, as the OR business manager, you have to put yourself in the shoes of the CEO or whoever's making that final decision and think how they think and build your business case accordingly.
Yeah, and lots of documentation, as you mentioned. Um, and then you also mentioned AI tools for patient risk stratification and scheduling. What are the most common implementation pitfalls you've seen with these technologies in
Mhm.
perioperative settings?
Yeah, that's a good question, because there are plenty of them. I think the most the one that's impacted me the most is always bringing the end users along for the ride, because at the end of the day, whether it's a scheduler that's entering cases into a scheduling platform or a pre-anesthesia nurse interacting with an AI tool to help risk stratify a patient, they're the ones using the tool. They are the ones that need to be comfortable with it, feel like they're a champion of it, and it almost needs to feel like they're the ones that are making the change. And so I think that's the biggest pitfall, is there are too many times where the most important stakeholder is not engaged enough from the beginning.
Good advice. And then what advice do you have for clinical leaders trying to introduce technology-driven changes like AI or CAM systems
Mm-hmm.
into a team that's already change fatigued?
Yeah, well, I mean, I think many people out there are tired of change, right? Because it's constant. And the unfortunate part for those people is it's not going away. And so I think it kind of goes back to my last question, which is, we need to we need to make it so that the people that are fatigued are the ones that are the most excited about the change. And if you can bring those people along, you're going to have less resistance. And so for me, it's engaging the boots on the ground people with the new technology and having them give input so that when the time comes for fatigue to set in, they're feeling better about the situation or more motivated to push through.
Excellent. We got another question coming in that
Mhm.
says, if you're using case minute volumes actual to budget for your primary metric, how do you use that for calculating your FTE budget, or do you use some other metric?
Yeah, that's a good question. So, um, we have, I know I'll speak on behalf of my current situation, which is, you know, the we use productivity essentially to justify FTEs. So we take the amount of surgical minutes that we're doing and we divide that by the exact number of hours that our staff is working, and that's our productivity indicator. And so we have this worked hours per unit of service kind of metric, and that's how we say, okay, it takes us 1.5 hours to do a case, or it takes one, there's some sort of calculation in there like that, but that's how we take our surgical case volume, our worked hours, and we translate that to how many FTEs do we need to do our actual case volume, not what was budgeted for, because we all know we could meet or not meet budget, but there's a flex FTE target that we're trying to reach, and that's how we calculate it. I
Thank
hope that kind of answers it.
Excellent. Thank you. Another question, how should perioperative teams account for strategic priorities like service line growth or surgeon retention that may not align with high margin cases?
Yeah, so I think, most people would agree that many facilities out there have a duty to serve their communities, and there's always going to be that key. I this is something I have to remind myself all the time of, is like, the patient is first,
Mhm.
and you have to, the only reason I have a job is because there's patients out there that need care, and you need to align your facility accordingly, and that might mean that you focus your efforts and money and investment on services that don't generate quite as much money, but there is the community benefit. And those services can, in some cases, lead to revenue in other areas. So if you do a good job at a low profit surgery, but then that patient was pleased with their experience, and then they bring their kid to the ED, a month later because we have a good reputation. I think that's the important part with that one.
That's excellent. Thank you for that. Um, we got a couple more questions. When you evaluate capital purchases, purchase
Terry, if I
ROI.
could,
Oh yeah, go
if
ahead.
I could, I see one from a question that says, "What's a great same-day
Great.
cancellation target?" And
Yes.
found any intervention specifically helpful. So, I think the target is 2%. A 2% cancellation, like same day or late cancellation target, I think is a healthy one. Some people would maybe argue that you could get even below that,
Mhm.
but to me, 2% is a good target. I think a couple of things that I found particularly helpful is providing instructions, via a video or via a MyChart message or email, and reiterating what exactly we need you to do, what medications to stop taking or taking, um, when to stop eating food, what to wear, not to wear, all those instructions. If you just tell them over the phone or in a brief clinic visit, they're going to forget. So reiterating that information in written form, video form, just basically spamming that information out there is important.
Mhm.
Um, and then I would say another one, which is way harder to do, is just care coordination, making sure that each step of the process, the referring provider, the surgeon, the anesthesiologist, the patient are all coordinating the sequences of the steps very carefully, and they're all working together, which that's the challenge of all challenges right there.
So 2% is the target.
I would say.
The threshold. All right. So when you evaluate capital purchase ROI, do you factor in soft benefits like surgeon recruitment or only hard dollar returns? And how important or difficult is it to translate the soft benefits to the C-suite?
So I'll answer the second part of that question first.
Okay.
I think it's actually very easy to translate soft benefits. The reason I say that is because, in many cases, the leadership of the hospital is very aware of active surgeon recruitment or even at-risk surgeon retention. And so sometimes playing that card is actually easier than having to explain the numbers and get into the nitty gritty of a financial return on investment. So I would highly encourage anybody listening to play that card, because it is one that I think resonates well with executives is strategic alignment. They know how important of an asset many of these surgeons are. And
Mm-hmm.
so it's a good card to play.
Excellent. And I think we got one more question here. Given the wide variety of facilities and constraints you went over at the beginning, from ASCs to academic medical centers, which operational efficiency metric trends, which operational efficiency metrics tend to deliver the fastest return on improvement across different settings?
I think that's it's a loaded question. And if you ask people that are listening, everybody would probably answer something different. But, I like the staffed room utilization metric. I think it's very transferable across the different facilities. But one that annoys me a lot, but is super important, is turnover times.
Yeah.
Because that time in between cases, as hard as it is to get that right, and as many things that it takes to do that right, that to me builds a culture
Mm-hmm.
of throughput and excellence by making sure everybody has their responsibility. We're doing it sequentially, we're doing it in a timely manner, and we're maintaining our schedule, all of those things. So I would say turnover time to me is, if you're doing that right, you're probably doing a lot of things right.
And everyone's aligned and
Mm-hmm.
more efficient.
Yeah.
Well, that's great, Zach. This has been incredibly helpful, and I'd like to let all the attendees know this session has been recorded. We've had a few people who want to go back and watch your presentation, and I'd like to remind everyone too, where this is just scratching the surface. There's lots more like this to be discussed at the OR Business Management Summit, and as a thank you, we are offering that 10% discount when you register online. Enter the promo code preview. Really like to thank you, Zach, for your presentation, and thank you to all the attendees for listening today. And so we'll see y'all in Austin, Texas, February 9th through the 11th. Thanks again.
Yeah. Thank you. Thanks, Carrie.
Thank you, Zach, and have a great day, everyone.